Hello everyone. We are going to tell you about this mixed method approach to describe violence and mortality among Malian refugees and host populations in Mauritania in the Bassikonou district. Now, for more than a decade now, the Sahel region is faced with a high-level security and humanitarian crisis. Because of insecurity, several families had to flee Mali to reach Mauritania. The first waves of refugees arrived around in 2012, and the latest waves started in August 2023. They are in the camp in Beira. Now, there are several questions or issues. You see, the majority of interventions are limited to the Mbera camp. So we wanted to know more about the people who are refugees but outside the camp. The main objective is this one. We wanted to describe and also put in perspective, to contextualize mortality and experiences of violence among Malian refugees and in the host population, the host community. In order to do so, we had secondary objectives, i.e. estimate the size of the refugee and host populations in villages hosting refugees, also calculate crude mortality rate, CMR, and also under 5 mortality rate, and identify main causes of mortality, and also review the types and frequencies of violent events among refugees and in the host community.
Pour la partie quantitative,
now, the quantitative methods is designed as such. It's a retrospective survey with 2-stage cluster sampling. And we targeted all refugee hosting villages in Bassikonou district with exclusion of Mbera camp. All family members during the recall period from August 2023 to January 2025 were taken into account, which gives us a period of 17 months for recall. And we used GIS. The GIS team helped us to count the shelter roofs, and we ended up with a random sample of 126 clusters. Between the January 6 to 18, 2025, we gathered a sample of 828 families, 4,511 individuals. 18.9% were refugees. However, there's an underrepresentation of men aged from 20 to 24 among the refugee population. In order to get population estimates, we have decided to include 2,653 geolocated shelters among the 37,317 shelters from the GIS survey, so that it gives us refugees 17.9%, host community 82.1%, with an average number of people per shelter of 3.1 in the community, 4.5 for refugees. Now, we then ended up with an estimate for a population of 29,739 refugees, 692 returnees, and 94,898 residents or community individuals. This is to assess mortality. We express this in the number of deaths per 10,000 per day during the recall period. And we could see that the CMR was twice as high among refugees versus the host community. However, if you take a closer look at men, well, among men in the refugee population, it's 3 times higher versus the host community. On this map, you can see in green Mali, in orange Mauritania, and the circles are proportional to the number of deaths per site. Red for refugees, purple for host communities. We can see that two-thirds of refugee deaths were recorded while still in Mali, and 4 deaths out of 7 for refugees are associated with violence. And in order to try and assess the level of violence, we calculated the violence incidence rate, accounting for the number of violent events per 10,000 per day during the recall period. In fact, this rate is 5.9% for refugees, versus 0.5 for the host community. And it is important to note that the non-response rate is 3 times higher among refugees versus the host community. On this map, you can see the geographical distribution of violent events, violent episodes, and Mali in green, Mauritania in orange, and the circles here again are proportional to the number of events per site, and refugees are shown in red, purple communities and returnees in purple. One can see that these violent episodes reported by refugees took place in Mali, and therefore the security level is higher for refugees as soon as they can reach Mauritania. Now, looking at the nature of the violent episodes, well, violence is reported by refugees while in Mali, and the sexual violence cases are originated from the host population. And here I like to hand over to Pascal to give you more detail on the qualitative component of our study.
Merci Gaston et bonjour.
Now, thank you very much, Gaston. Hello, everyone.
Donc, pour la composante qualitative.
Now, this qualitative component was performed in 3 sites in the district of Passy-Conou, guided by the outcome of the quantitative study, while making sure to get enough diversity, both geographical and social, for participants. We included the rural area of Matlé, and it's close to the border with Mali, and also the semi-urban Douentara site and the Agor site, which is the location of the former refugee camps, where communities live separately. We have used the peer method, which is participatory ethnographic evaluation and research approach, taking advantage of the local researchers and their trusted relationship with their communities. So we train these peers and train supervisors on the quantitative component. They could help us with reliable translation, with contacts, with the easy contacts to the communities, and implementation of the study. And following mapping, we conducted community-based consultations with the authorities, representatives of the key stakeholders, in order to introduce our study and also to call on them for the participation, for the identification of peer researchers among the community. So we selected these peer researchers, PRs, with a number of criteria. We didn't want them to be in positions of power and also to be then we train them for 2 days in the language of their choice with an interactive training system based on their literacy levels. This was variable and targeted towards the collection of qualitative data and also ethical issues. After training, we asked them to conduct interviews with the participants around 5 key issues. Then we organized individual debriefings of these PRs for narratives, for feedback of the interviews. We documented this with executive summaries and also audio recordings with counseling services offered to these PRs. This is to help them to manage the consequences of having led the interviews. Then we organized community workshops for feedback open to anyone, all members in the community. This was organized by the authorities with participation of PRs, MSF and MOH representatives, and we did so for approximately 6 weeks. Now, our results, we worked with 31 PRs who conducted interviews with 68 participants aged 20 to 83. In these 2 groups, there was a well-balanced composition with participants from different communities, Tuareg refugees, Fula refugees, Arab refugees, and very often the criteria put forward was to answer the questions of PRs were the fact that they trusted them and considered that they were honest, and also they wanted to report on the violence experience. Now, when you look at the interviews, you can see that there were attacks conducted by armed groups with arbitrary executions by firearms, beheadings, hangings, people burned alive, sexual violence, torture, beatings, kidnappings, rape. This violence was targeted mainly towards men and young boys, but with also extreme violence against women, pregnant women, and families. These acts were committed in public, and of course it was a source of terror for the population. Many testimonies of loved ones murdered and or assaulted were seen, with few accounts of direct violence. In these reports, you find also looting and destructions, thefts, also repeated violence, repeated threats, and all this forced the population to exile. Now, fleeing to Mauritania was often done hastily, leaving everything behind, dangerous journeys over several days with many episodes of violence along the road, and also the risk of violence that was felt up to the border, meeting up patrols and drones along the route with random searches, robberies, executions, arrests, and kidnappings. Once in Mauritania, participants report that the violence is still felt psychologically and physically, with intrusive thoughts, depression, anxiety, sleep disorders, social isolation, an ability to speak, also psychosomatic pain and reproductive consequences with several spontaneous abortions and neonatal death or maternal death that were attributed to the trauma provoked by the violent episodes. The living conditions in Mauritania are difficult and with an added burden for these refugees with economic precarity, food insecurity, limited access to water, poor healthcare access, inadequate service availability, and a lot of these people have to beg or they are indebted. And of course, all this is a burden on these populations of refugees. But it's also a burden for the communities, host communities. This is an economic strain, and their incomes decline. There's also increased competition for basic services such as wash and healthcare. And of course, this does contribute to intercommunity tensions, and it is a threat to long-term peaceful coexistence. So in our study, we could see that there are significant differences between the host communities and the refugees. The refugees are more often exposed to violence, and they also experienced extreme violence episodes during their journey, and this of course is also combined with precarity once in Mauritania. We think there is an urgent need for multi-sectoral interventions to respond to the acute psychosocial vulnerabilities and critical needs among refugees and host communities with food, water, safe shelter, livelihood, protection, access to healthcare, mental health, sexual and reproductive care. With this participatory mixed method approach, we think that we were able to quantify and also put in context the patterns of violence and violent deaths and amplify community voices. There were, of course, limitations, but we could highlight humanitarian priorities to inform advocacy and provide actionable operational recommendations. We would like to thank very sincerely the communities of the Bassi-Kounou department, the peer researchers, the study participants, and the communities that participated, and also the MOH and MSF and Epicentre teams. Thank you.